So, our today's guest, consultant psychiatrist, specialist, underwent training in US, in India, YouTuber, educator in the Faculty of Psychiatry. Please welcome Dr. Praveen Tripathi. Hi, Dr. Praveen. Welcome to the show. And I hope today a lot of students can learn from you, from your expertise, from your experience. And without much further ado, let's start our conversation. And the number one, I think the question when I posted, like, what would you like to ask Dr. Praveen? It was how to manage stress in medical school. Because there are so many subjects, so many studies, and you have a lot to do. There are practicals on top of it, exams, and there sometimes it can just go on top of everything. So stress is a lot, and I think it's a very key topic. So we would love your expertise on how to manage stress in medical school.
Right. Thank you, Subha, for having me. The pleasure is all mine. Subha, that's a very difficult question, and I don't think there is a very easy answer to that. How to manage stress? But I would still want to make a couple of points. If you look at an average medical student, the amount of work that student does tends to swing between extremes. Just before the examination, we tend to study a lot and we get overwhelmed and we get all anxious and everything. And then when the exams are over, for the majority of students, they simply stop studying at all, right? So the life of a medical student swings from not doing much work to being extremely overworked. So and that is how stress levels are. There are times when you don't feel stressed out at all, and then before the examination it hits a peak. So if you want to manage your stress, one of the key point is to bring some amount of regularity or some amount of consistency in the work that you put. Now, said that, it is almost impossible that any student can study throughout the period with the same amount of consistency, but at least it is some amount of consistency, some amount of effort on an ongoing basis will significantly help in reducing the stress at the end. When we talk about stress, it's not always bad. There's a term in psychology, we call it eustress. Eustress is the good stress. So, in fact, if I can talk about some psychology principles, if you plot the stress with productivity being on y-axis and stress on x-axis, we get this kind of curve. What it means is, as the stress increases, the productivity also increases to a certain extent. And after that, if stress increases, the productivity tends to go down. So basically what I'm trying to say is some amount of stress is actually good. If you're not stressed at all, why bother studying, right? So some amount of stress is good, but in many cases what it happens, it crosses that important point and then it starts hampering your preparation. So we have to ensure that we stay on the left side of the graph and not go on the right side of the graph.
Right. Perfect.
Apart from that, Subha, if I can make some general points, the career of a doctor and even the studies that we have to go through before we become a doctor, it's a very long period, and it is impossible to stay at the top of your game all the time.
Yes.
It is impossible to stay at the top of your game all the time. So we have to understand these things and we have to ensure that we are not only studying, we are doing things beyond studies. Sometimes I see students become overtly serious, too serious about studies, and then they burn out very easily, right? You must remember that you should be using your body and your brain in a proper way. You should be extracting things out of your brain and body at a speed which can be replenished to. If you put too much of stress on yourself, if you one fine day you get up in the morning and if you say I'll study 15 hours a day from today, in all probabilities by the end of the 10th day you would have burned out. Right?
Yes.
So use your body and mind in a proper way, give it proper rest, engage it in other things beyond studies so that you can the longevity is there. Don't have a short burst of highly productive days and then everything goes away. Don't do that.
Okay. So this is how we should manage our stress, staying consistent, not being on the extreme, I'll study 15 hours, then I'll study 0 hours.
Right.
So staying in the consistency and staying on the left side of that graph. But sir, okay, I take your advice. I am consistent throughout my medical school, but still there comes a point, there is exams approaching, and then there is anxiety. Anxiety about how will I perform in the exam? What if I get sick during the day of the exam? What if something happens to me before the exam, 2 3 days before exam? Or anxiety about the results. Anxiety also, some students compare their own preparation with other students' preparation. So even though stress is managed as per your tips, but still the anxiety catches up when the exam time is, or any important date is approaching. So how to cope up with that?
Right. So that's a good question. I'll give a very simple tip here, and again, this tip is taken from the CBT sessions, the cognitive behavioral therapy that we usually do with patients. See, the problem with anxiety is it makes you believe that something which is very unlikely to happen is about to happen. Uh, just to make my point more clear, I'll give you example of something that happened during my medical college days. One of my friends, one of my best friends, in fact the best friend, his name was Rashikar Chakraborty, a very brilliant guy. He would always get into in the top 3 in the class, right? And he had gotten some 40 rank all India in the PMT examination. So very brilliant guy. And I remember we came back to the hostels after taking our surgery exam, and both of us came to our room and we were just discussing, and he was like, Tripathi, he used to call me by my surname, Tripathi, मैं तो फेल हो जाऊंगा. And I was like, तू फेल हो जाएगा, अगर तू फेल हो गया मतलब सारा बैच फेल हो गया, right?
Yes.
And that guy actually meant it. He was not one of those guys who just say things like that. He had never said that something of that sort in the entire 4.5 years, and he said that I might fail in the examination, and that was anxiety speaking. So what anxiety does is it makes you believe in the least possible scenario, or it makes you believe that the least possible scenario is about to happen, right?
Yes.
So say tomorrow is your examination and you get a thought, what if I fail in the examination? Just pause up for a moment and actually ask yourself, is it really going to happen? Is it the most likely thing that is about to happen? Or is it my anxiety telling me that something very extreme is about to happen, right? Is it my anxiety speaking? And even when you're anxious, your rational self would be able to give you a good answer. Your rational self will tell you, okay, the worst that can happen is maybe I would not be able to score as well, but failing is unlikely to happen.
Yes.
So that positive or that self-talk, I would not even call it a positive self-talk, I would call it a rational self-talk. So if that rational self-talk keeps on happening, you would be solving most of your problems. So for example, I am doing a podcast for you students. I get hundreds of messages every day on Instagram ki same question. एक ही क्वेश्चन आता है कि सर क्या करें. What do you think? I do not get these thoughts. What do you think? If I become a psychiatrist, I am immune to all the anxiety provoking thoughts? It's not that.
Of course
But
not. Of course not.
Yeah, but what I do is, if I get a thought like this, I tend to answer myself in a rational way, and that answer is usually enough. And there is no reason why can't a student do that. If you have a thought कि यार pass ही नहीं हो पाऊंगा या fail हो जाऊंगा, ask yourself, is it really about to happen or is it my anxiety speaking? And you yourself will answer कि यार fail तो नहीं होगा, at worst result उतना अच्छा नहीं आएगा. Right? So this is a good skill to develop. This is a good skill to develop. Ask your rational mind the same question that you are asking others.
Okay, so sir, like people follow daily journals and all. Will it help in this rational thinking? Because in daily journals you also ask these questions to yourself. How do you feel today? And etc. and etc. So is this something similar?
So the problem with daily journals is, it's difficult to follow them for a prolonged period of time. After a few days you get bored, right? Yeah. So I think we should use these skills sparingly, or rather than using the word sparingly, we should use them when they are required. There is no point, asking yourself all these things every single day, because they would lose their efficacy. So when it is required, you ask those things, but you have to remember that this is something that I can do to make myself feel better.
Okay. So rational thinking whenever you feel anxious is a tool which we all can use before exams.
Right.
Yes. But still, sir, I listen to your advice. I manage my stress in medical school. I listen to your advice. Whenever I get anxious, I do some self-talk by myself and calm myself down. and do rational thinking. But then many people have this question the night before exam. Exams are usually in the morning. The night before exam, no matter how early I wake up the day before to so that I can sleep the night before exam, it just doesn't happen. Then people sought or students sought for some pharmacological drugs for sleeping, and that's a one-time drug just before the exam. So, what are your thoughts on that? How to manage your sleep just the day before the exam, and what are your views on taking these pharmacological drugs for it?
So, okay. So first of all, we have to understand what is the main cause behind that insomnia the night before the examination.
Yeah.
Right. We all know that it is stress or it is anxiety, but
Yeah.
what can be done about it? Uh,
Yes.
before I answer that, I'll also draw your attention to something else. Often you would see people saying that before starting your day or the night prior, always make a plan. How will you be
Yeah.
using your next day? This is a very common tip
Yes.
given, right?
Yes.
And that tip does not stand to the scrutiny of the whatever we know about the psychology of human mind. For some people who are very confident, who are not anxious at all, it is okay to make a plan about the next day and then go to bed and be able to sleep. But for a significant number of people, I would say probably the number is more than 50%. If you're planning about the next day, along with that plan, the anxieties about the next day and the anxieties about your life would also creep in, right?
Yes.
And making yourself anxious immediately before going to bed does not make any sense at all. So
True.
when we talk about sleep hygiene is basically a couple of things that we should do to ensure that we are sleeping better. One of the most important advice is do not do anything that may make you aroused or maybe anxious or even excited or even motivated before going to bed. So never listen to a motivational video, never read a motivational book, never read anything that may increase the excitement levels. And keeping that line of thinking, you should never plan for the next day immediately before going to bed, because that is likely to make you a bit excited or a bit anxious, and that will worsen your sleep. So again, the same thing happens with the exams. If you're going to the bed and if you're thinking about the possible scenarios कि ये हो जाएगा, fail हो जाएंगे and all those things, so that may be the reason why you're not able to fall asleep. So it is a difficult thing to do. I mean, easier for me to say, but a difficult thing to do, but still can be done, right? You can in patients with anxiety, we use a concept of worry time, right? So basically, a patient comes and says, "Doctor, I'm always worried. I'm always thinking about stuff that may happen." So a common advice given is, whenever you have those thoughts, just tell yourself, "Stop. These questions are important, but I'll think about them between 2 to 2:30 in the afternoon." So that 2 to 2:30 is the worry time, right?
Okay.
So what happens with that is that you are not discarding those thoughts. You are acknowledging that, okay, these are some of the important questions, but I would not be pondering on those questions at this point of time. Rather than that, I have a time slot, scheduled from 2 to 2:30 when I'll think about these questions, and you actually do that.
Okay.
Right? So these are some of the things that you can do before going to bed, and that does help to a certain extent. I mean, there's no magic pill, but doing these things may help you. Listening to music, listening to soothing music, it usually works very nicely. Some people like taking shower just before going to bed. Some people like reading some book, non-medical book, but at least not thinking about the next day can be done. As far as the second part of your question is concerned, taking some pills, something like zolpidem or some benzodiazepines. So, the worst thing that you can do is to try a pill for the first time the night before the examination, right?
Yes, of course.
That is a big no. That is a big no, right?
Yes.
We know that half-life of zolpidem is like five and a half hours. So it is not likely to be there in the bloodstream in any significant quantity by the time you reach the examination center. But everybody is different, right? There are people who may develop deep sleep. They may not be able to get up in the morning the next day. If we talk about drugs like Alprex and benzodiazepines, they may actually bring down your cognitive skills the next day. So you may not be at the at your best the next day. So you should not do that. But in certain cases, if this has been a pattern, what I advise students is that if you plan to take a pill the night before, take it multiple times before the actual exam date, so that at least you know how your body reacts to that.
Okay.
I have done it. I have done it once myself before step 1 of USMLE. That was one of the times when I took a zolpidem before going to bed, and it did help me. But I had followed the same thing. I had taken it thrice before, so I knew that it does not make me too sleepy. So, I mean, you can do it once in a while, and usually under the supervision of a doctor, of a psychiatrist.
Of course.
But I know no student would listen to that advice. So even if you are planning to, even if you are planning to do that, don't do it for the first time the night before the examination. At least don't do that.
Okay. So that's it about our stress, anxiety, and the how to get better sleep and sleep hygiene in general, especially before exam day. And now you touched upon the topic when you gave your USMLE step 1. Let's just go on to that topic. Even I am preparing for USMLE currently, and I can relate to it. What would my day look like just before my exam day? So, what if we compare postgraduate in India and postgraduate in United States or anywhere abroad? What are your thoughts on that?
So, what are my thoughts? It entirely depends upon the person. It entirely depends upon why you are going to US. First of all, see, before deciding to go to US or England or any country for that matter, or deciding to come back to India or staying back in India, you have to ask yourself a very big question, a very important question. What is it that you are looking for in US? And the answer kind of defines whether you are going over there for the right reasons or not. I went to US in 2010. It's been 11 years. For the first time I went to US in 2010. And what was my reason for going to US? I was a bit disenchanted with the Indian medical system. Right? We were like, I did my MBBS from UCMS Delhi, University College of Medical Sciences, which is considered a fairly good college, right?
Yes.
And we were like, yeah, if UCMS is like that, and we had friends from MC and all of us by the end of internship, we were like, यार क्या है, कुछ हो तो रहा नहीं है ठीक से. And we were like, if the medical colleges in Delhi are like this, then there is no hope in the future. So we were a bit disenchanted with the medical system of India. Secondly, at that time, I think the salary of PG was 25,000 rupees per month. It was 25k. They had increased it to something like 50k an year before, but it was something around 25k. And we were like 23, 24 years old at that time, and all our friends who went to IITs and good colleges, they were getting good packages, and everybody was making 1 lakh, 1.5 lakh rupees. And at that age, you tend to compare. He is getting 1 lakh rupees today, and today will be making 25,000, and this is going to continue for 3-4 years. If I do SR-ship 6 years, and then you feel really frustrated. And then you hear about USMLE, and you get to know that a resident gets like $3,000, and the Indian mind immediately calculates that $3,000 is equivalent to this many rupees. This is what we do. And then you decide कि ठीक है, चलो US चलते हैं. So one of the reasons is this, that you want to make more money, which is a fair reason, nothing wrong in that.
Yes.
Second reason is that some students think that it is easier to clear the step 1 and step 2 of USMLE and the CS. Now they have removed the CS, and it is more difficult to clear the PG entrance examination. I doubt it. There's a big question. Is it actually backed by facts or not? But this is one of the, there's another reason why many students opt for USMLE. And third reason, especially many of the students who do not have, who come under the unreserved category, so-called unreserved category in India, they are like reservations, ye hai, wo hai, and let's go to US. Again, not going into whether reservations are fair or not, that is something beyond the scope of this conversation of ours. But some students say that this is why we want to leave the system. Fourth reason that has come up more in the last couple of years is the violence that we see in India. An average medical student gets very disheartened when he hears about the violence that is happening, and it's actually a very unfortunate thing. And again, that again leads to disenchantment with the system. This is not a place to live. I think these are the main reasons why people go to US. Do you want to make any additions? Anything else?
I think as a whole, you have covered everything.
A very small number of students want to go to US because there are research facilities available, and because they are able to, they want to work with the
better training,
better training, better technology, and they believe that the work-life balance is better over there, right? So some of them do it for these reasons. Yeah. So depending upon your reason, I would say the decision may be right or wrong.
Okay.
First of all, just because you are unhappy with one system does not mean automatically that the other system is better than that, right?
No system is perfect.
No system is perfect, but even according to your criteria, just presuming that the other system would be better is a fallacy. Yeah. I think it should not be done. But then, what is the other way? You cannot experience both the systems. That is the biggest problem.
Yes.
So that is why people have to just follow their intuition and take a step. कि चलो ठीक है USMLE करते हैं. Now let me talk about all the 5 reasons why people go to US and give my thoughts about it. Before saying anything, I must confess that I'm a bit biased here, because I went to US. I stayed there for 6 months. Everything was going hunky dory. Everything was nice. I got a very good step 1 score. I cleared my CS examination with very good results. I had I think 5 months of elective, 2 months of experience of working on a project. Everything was good, and and still I came back to India after 6 or 6.5 months. So when you talk to a person who left the US and came back, of course his views are going to be biased, right? So whatever I'm saying, please take it with a pinch of salt. But let me try to be as objective as possible. Let's talk about the money thing first, right? This is especially for Indian medical students. Indian medical students, for some reasons, believe that all the doctors are really poor, and they believe that they don't make any money at all, which is not true. The reason why they get this thought is probably they look at their professors or the doctors who are working in the medical colleges, and even they make a decent amount of money. But if you compare a professor or a lecturer in a medical college with somebody who is living in US and compare it, it would be an unfair comparison, right? So first of all, what Indian students think that the amount of money the doctors do not make that less an amount, especially if you go to smaller cities and smaller towns. Doctors are usually one of the wealthiest people, right?
Yes.
So lack of knowledge is one of the things. Secondly, I always argue about this, that in absolute numbers, a doctor in US makes like twice or thrice the money that an Indian doctor would ever make, right? That is a fact. But the quality of life does not automatically become better with that money. Reason?
The cost of living is high there.
Cost of living, and there are certain things that are only possible in India. I'll share an anecdote with you. I was in US. It was again in 2010, and I was in Kansas City, and we were living in this international house. So at KUMC, Kansas University Medical Center, they have an international house, and people from different countries, students from different countries come and stay over there. So when I was there, there were 2 Indian students. One guy was from Syria, and then there were 3 German students. Victoria was there, Hendrik was there. So there were 3 German students, and once we were sitting in the living area and was just having a discussion, and we were just telling about India, and I told them that most of the Indian households, they have a help, they do get a cook and a chauffeur, and she was like, "You must be very rich," and I said, "No, I actually belong to lower middle class." Right? Of course not rich.
I've had the same conversation studying in abroad, medical school in abroad. I've had the same conversation with foreigners.
Okay. Yeah. So and she was like, I told her, no, I don't come from a very rich family. It's a very lower middle class family. And she was like, how could you afford all of those things? And I was like, everybody has these helps. We never even we don't even think about it, right? Yes. And then she asked me, so if you guys have such a comfortable lifestyle, why do you want to come over to US? And I was like, that's a fair question. We sometimes we don't acknowledge the things that we have in India. We just take those things for granted. Now, somebody might say that, it's not a big deal. We can do the stuff. But when you go to US and when you actually start doing your dishes, and you actually start, preparing the meals, and, for the first time you learn how to do the laundry, and you learn that there's a dryer, and then there's a...
Yes.
I'm sure you must be aware of all those things.
Yes, all the logistics I've done.
Logistics, yeah. So when you go outside, when you do all those things for the first time, then the question pops up in the mind that, is the quality of life actually better, right? Even after doing all these things, some people may say that the quality of life is better in US because of the better roads, less pollution, all those things are there, of course. But all I'm trying to say is that you'll have to debate that. You'll have to think in your own mind that there are certain things which are so much more better in US, but then there are things that you can never have in US. I mean, it's almost impossible to have a cook, irrespective of how much money you make. And here everybody has a cook, right? So those things do make your life easier. So coming back, I think I went on a tangent here, but coming back to the whole money debate, making money is one thing, and being able to do stuff with that money is another thing.
True.
I'll say another thing. This is a more of an emotional thing, but let me make this point. If you talk to your friends in US, almost everybody is driving a BMW, or everybody is driving an Audi or Audi, whatever, however you pronounce it. So you tend to get bigger cars, and all those things are there, but you don't have people who will sit with you in that car, right? I would rather buy a sedan and have my mother and sit along with me than drive a BMW and all by myself. So again, this is a very emotional point, but it is very applicable for a large number of people. For me, it was applicable. I remember going to Kansas for the first time, and I got out of the hotel and I looked at the street and there was nothing. I mean, this is how it is in US and even other countries. And we were like, man, I'm in the middle of nowhere. There's nothing. Yeah. Even if you give me the biggest car in the world, what would I do with it? That said, it's not always that bad. That was a student phase. Later on, you develop friends, you make friends, and you develop you have a circle, and you start going out. It's not that lonely later on, but your social life can never be as good as it is in India.
As it was back in your home country.
So, does it matter to you? Are you a very social person, or it doesn't matter to you much? Again, that's a very subjective thing. If you say that I don't like meeting people anyways, fair enough. But people who say that I don't like meeting people anyways are also the people who go and miss people.
Yes.
Again, one of my friends. In fact, we had this discussion before going to US. We were like, some of my senior made this point to me, and again, this was back in 2010 or 2009. कि दोस्त नहीं होते हैं, अकेलापन होता है, and we were like कि यहाँ पे भी कौन सा हम लोग राह चलते आदमी से बात करते हैं, right? You don't talk to strangers even in India.
Yeah.
But once you leave the country, you realize the difference, and that's a very stark difference. I don't think you should make your decision on that single aspect, but you should consider that. You must consider that thing. At the same time, for many people, it's a blessing in disguise. There are many people who feel suffocated over in this country, who are not able to express themselves. And for them, it's a paradise. There are a few friends of mine. One of my friend, he had a homosexual orientation, and he felt very suffocated in India. I mean, understandable. And when he went to US, he could be himself. He could express his sexuality, and I think that's a big point. For him, going to US makes all the sense. And that's only one thing that I'm talking about. You might be unsatisfied with tens of other things, and if you are feeling suffocated, then going to US makes a lot of sense.
Yes.
So all I'm trying to point out is that it's a very subjective decision. Depends upon your circumstances and what you're looking for. Right?
We should think about it before deciding to go to US. All these factors.
And one thing that you must never fool yourself with is the idea that I'll come back. If you are somebody who is not very sure about going to US, it's a part of you wants to go over there, other part doesn't want to because of family or any reason. You tend to tell yourself that, okay, I'll go there, do the residency, do the fellowship, and then I'll come back. That is almost impossible to do, right? After going through the rigor of US system, 3 years of residency and fellowship, when the time comes to make some money, you can't come back to India. And and nobody's waiting for you in India, right? People think that big
Yeah.
corporates will be waiting for you. It doesn't work that way. You'll have to start from the scratch, and there's no point starting from the scratch after all these years. So,
Yes.
one has to be very realistic about this question. It's a very important thing. It's a life changing thing. Uh, Good or bad depends upon you, but you should give a lot of thought behind it. Put a lot of thought behind it before you take a call. People talk about reservations, but they don't realize that even in US, you would be taken only in those programs where they can't find an American graduate, right?
Yeah, there is some bias. Some programs will always prefer, and some specialties like dermatology or something like
Beyond the
that
scope, yeah.
will always prefer, yeah, US medical student over any foreign.
So yeah, again, so this is something that I wrote a couple of days back on Twitter or Instagram too. That even if you're going to US, you're getting only into those programs where they cannot find an American graduate. So reservation, whether you like it or whether you hate it, that should not be the only reason for moving to US.
Yeah.
People talk about these things, rural posting. You are aware of rural posting, are you?
Yes.
So,
Yes,
I mean, that's an unfortunate thing that has happened over the last 5-6 years. Students have to, spend 2 years or 1 year or 3 year,
Yeah.
I think it's very unfair. But the same thing is there in US. If you go on J1
US.
visa, you have to do
Yes,
3-year waiver.
depends on
waiver
the
job.
visa. Yes.
Yeah, and then they throw you in the extremes, far-flung places. They are no better than our villages. So what I'm trying to say again is that there are certain very good things about your system. There are certain bad things about the US system, and think about it and then take a decision. And there are people who are very happy because they moved out. There are people who are not so happy. So depending upon how you feel, what kind of a person you are, pick one.
Okay, so this was, I think we've covered a lot about US.
I can speak for an hour more on this topic.
Yes. No, like this angle, I think I've never heard before. People usually talk, as you said, about the money or the quality of training, but this is an angle which I am also, contemplating now. Like, oh yes, these are the things which I should also think about when deciding, or any student should think about.
These are very, I don't know how to describe them. I think they're very soft points, if I can use that word. The problem is in US, see, you don't become an American if you go to US, and you are no longer, you don't remain an Indian. You are kind of stuck in the middle. You try liking baseball and basketball, you don't really like it. You like cricket, right? And you try to enjoy Halloween and all those things, but I mean, you have to really force yourself. So for some people, it comes very naturally. I was in New York City. What is that place? With all the big screens and all in New York.
Times Square.
Times Square. Yeah. So I was at Times Square on the Halloween, and with all those beautiful parades going on, and everything was so glittery, but I felt a bit lost. Everything was beautiful, but I found it difficult to relate with that. So
A cultural shock,
yeah,
maybe something like
cultural shock, maybe, yeah. And I asked myself this question that I told myself I should try to like this thing. I mean, let's not behave like a kid. You are going to a new place. It's New York City. At the end of the day, it's like the greatest city in the world, and you cannot say that just throw me back to Delhi. But the question that came into my mind: why do I need to force myself? Why should I force myself to do something that is not coming naturally to me? But again,
Yes.
that is something that I felt. This is not felt by many people, and they are happy. They are okay. So if you are somebody like me, then you will feel all these things. But not everybody is like me, right? So again, everything comes back to the
everyone is
same,
different.
the subjective thing. Yeah.
Yeah. So everything is subjective, but yeah, these are some points we should think about before deciding.
People don't talk
anything.
about these things.
Yes.
People who go to US, they tend to only talk about the good things about US. They don't really talk about the bad stuff.
Everyone will be, wherever they are, they will be a bit biased
हाँ,
towards
ये होता
there.
है, right.
It's very subjective at the end of the day, as you said.
True.
But okay, completing this topic about residency or training in your future after medical school. Before that, you have to give a lot of exams. All the students, whether you are training in India or in gearing up to training in US, lot of exams, and for lot of exams, there are a lot of distractions. There is lot of wastage of time, and again, a very common question. I think people ask you hundreds of questions in one day, maybe minimizing distractions and wastage of time, and how to do that.
Right, right. So a very difficult thing to do, especially in today's time. And
Yeah,
I
with
must,
all the technology.
yeah, and everybody is struggling with it. Even me, I struggle with it because so many things are happening. Somebody is sending a message on Twitter, on Instagram, and at some level you want to be connected. At the same time, you understand that it is leading to wastage of time, and you're always trying to strike that balance. I'm reading a book. I don't know where that book is. It's called Deep Work. It's a very nice book. I was reading about it, and I would recommend it to anybody who is facing this issue. See, first of all, we have to remember that this whole multitasking thing, this makes us feel as if we have been working a lot, even when we are not. Right? What happens is, say I'm in the middle of writing a book as of now. I open my desktop, I start writing on it, and then suddenly I think that okay, let me read about this topic from some website, and I open that website, and almost involuntarily I also end up opening another tab, and I spend a lot of time reading news for some reason, and I open NDTV or Hindustan Times and I start reading about the news, and then in the news I'll read something which is interesting, and then I click on that and I go on another tab, and from the third tab. By the time I realized that I was looking for something else, already 30 minutes are over, and you don't even realize that you are doing something else than what you originally intended to.
Yes.
This is one thing. Another scenario which is even worse is you are doing something and then you get a message on Instagram, say from a student or from a faculty or something, and that say they are asking a question, and now you are replying to that question. Now, because you are replying to a medical question, you may feel that you are doing something which is important. It's not wastage of time, but you forget that you are still away from your original work.
Yeah.
And the research says that going back to that frame of mind, it's not that easy. It's not easy. You just cannot switch from one thing to another. So if you want to cut down on the distractions, first of all, it's a difficult thing to do, but you have to cut down on the number of chances or the possibility of you getting distracted. You have to cut down on that. What I mean by that, if you're spending too much time on social media, maybe uninstall some of the apps. Make it difficult for you to go on the social media. So for example, if you have to check Facebook, rather than having an app of Facebook, you ensure that you have to go onto the system, ensure that you have to put the username and password every single time. Right? Remember password option ko hata do. I have removed that. Because during that 15 seconds when you are opening Facebook and then putting the username and the password, you have that window where you can come back. Ki acha chodo, nahi karna hai.
Yes.
Right? So making it tougher for yourself is something that can help it.
Increasing the resistance. Increasing
Exactly.
the resistance between that.
Right. Secondly, multitasking is a big no. Again, don't do three things together, because you will feel that you are doing something when you are not. So if you're working, work. If you are having fun time, if you're listening to music, listen to the music only. Right? At least you know what you are doing. This is something that can really help. And third thing, see, again, that the deep work book I was talking about, ability to concentrate on a stretch for like 40 minutes or 45 minutes is becoming very rare. Not many people are able to do that. So if you are one of those who can sit for 45 minutes on a stretch or 1 hour for a stretch and do one thing, you'll get that huge advantage over others that may change the course of your life. I saw one of your videos where 3 guys were sitting together and doing something. I think you,
Yes,
Dr. Abbas,
yes.
and there was third person.
Yes. Yeah, Anuj, yes.
Anuj, okay. So that's a nice thing to do. Although even that is being done in the front of camera, so it's not completely distraction
That was
free.
extra motivation for us that okay, because there is a camera, I have to focus for 1 hour.
Yeah,
That is
but I'm
extra
sure out
motivation
of that
for
1 hour, few minutes went into that thought, ki, okay, camera is there.
Yeah,
But,
of course.
it was a good effort, and if we can replicate it without cameras, it would be
Yes.
so wonderful. But
That
a
was a
difficult thing to do.
motivation for us.
Yeah,
Yeah.
I'm sure. It was a nice thing to do. Uh, but yeah, this is how we do these things. Accepting that it's not a simple thing to do is the first step, right? Don't feel guilty about it. Don't keep on telling yourself that I'm such a useless person. I can't concentrate. Concentrating is difficult. Let's start with that,
Yes.
and now let's try to improve ourselves. I keep on saying this thing as a psychiatrist also. You should not be the person who demotivates you. You should not be the person who discourages you. Do not use those words ki you are useless, you do not know anything, you are such a wasted, you do so much of wastage of time. Don't do that. Try to be nice to yourself. If you wasted some time, I mean when I waste time, I tell myself ki okay, I did not spend time productive in a productive thing. It's okay, it's done. Let me start doing it now. Let me start doing something now. So at least this cycle of you wasting time and then you wasting time because you wasted time. You are at least out of that cycle. When you start using cuss words for yourself, you further decrease your motivation. It doesn't really help you. So taking care of yourself really may help you in becoming better at productivity.
Okay. And what about, so we covered on the topic of minimizing distractions, increasing resistance. But on the flip side of the coin, I also should minimize resistance between my target work. For example, if let's say you are writing a book, it should be least resistant path. Your computer should always be ready. It's not like you have to switch it on or something like that. Anyway, so what are some ways where we can improve this efficiency, or as we say, productivity in our studies as a medical student, or work if we are just practicing doctor or something?
So for medical students and especially for those who are preparing for some kind of exam, especially entrance examination, limiting the source or limiting the content is one of the very important ways of improving your efficiency. I mean, I have been teaching for 7-8 years now, and every year, I'm talking about the PG entrance examination.
Yes.
Every year, the pattern that we see is the same. In the beginning of the year, students are very energetic, over enthusiastic. They start with the subject and they are like, yeah, bisko to ekdam अच्छे से पढ़ना है. They'll start with one source and then they are not happy. They go to the other source and then do the questions from the third source, and they spend a lot of time on one subject. And by the time they reach towards the fag end of their preparation, now there's no time left, right? So if in the beginning itself you can tell yourself that okay, the time is limited, the amount of material that I can go through is limited, I have to ensure maybe at least 2 revisions, and let's not overspend time on any particular subject or any particular topic. If that can be ensured, that in itself will increase the efficiency by many folds. We must remember that completing all the subjects in 6 months for FMG students or 1 year if you are preparing for PG and all, it is almost next to impossible. You cannot do it properly. Yes. And you have to ensure that whatever time you have gotten, you use it properly. Many a times what to study is not as important as what not to study.
Not to study.
People don't realize that. People realize that by the time they are about to appear for the examination in the last months of the preparation. But this is a very important concept. People don't talk about it as much. And see, the problem with the technology is now with all the apps and all the institutes, you see very beautiful videos, all the animations and all the this integration, that integration, everything is happening, and it's also glamorous that you get drawn towards it. And I'm not saying it's totally futile. There are certain very good things happening, but I keep on telling this to my students that please take into account the time that you have, and then decide what all you can cover. During our times, one of the problem was that not many good sources were available, right? Now the problem is of plenty. There are too many good sources available.
Yes.
There are too many good sources available, and you always have that FOMO, fear of missing out, that I might be missing on something, right? Yes. And that is why you keep on jumping from one source to another, and you are not left with anything concrete. So if that can be taken care of, the efficiency would actually improve really multifold.
Okay, so choosing one source and also deciding what not to study is something we
And sticking to one
miss out
source,
on.
sticking to one source. Don't fall for FOMO. Fear of missing out is you should miss out on that, on fear.
Okay, we should miss out on FOMO on the FOMO.
Yeah.
Okay. So now moving on to our another next section in our podcast, which will be psychiatry as a career option. So first, as let's go from baby steps. First, as a medical student, the basic step, how to approach psychiatry as a subject. And of course, you have expertise in it. You are a psychiatrist and you teach. So what is your best advice you can give when a person is starting to study psychiatry or psychology for the first time?
So we are talking about entrance examination here, or we're just talking about as a medical student?
In medical school, eventually it will lead to also studying for entrance examination. But like first exposure to the subject.
So I always suggest to students that psychiatry is something that everybody should study. And I'm not being biased here. Even if you don't plan to become a psychiatrist, read psychiatry for the simple reason that it is likely to stick with you. If you read the textbook of psychiatry in your third year or in your final year, when you go for the examination, it's quite likely that you would be able to answer all the questions correctly, because once you have read it, it becomes very easy to guess the right answer. Right? This may not be true for say anesthesia. It's very volatile. You tend to forget these things. But psychiatry tends to stick with you. Once you become familiarized with the words, it's not so difficult to get to go for the right answer or the right option. So it's a very highly scoring subject. And also when you become a doctor, when you become a practicing doctor, irrespective of whether you are a cardiologist or a gastroenterologist or a surgeon, psychiatric disorders are everywhere. If we talk about the lifetime prevalence of depression, it is like 15%. Almost every sixth person is likely to have a depressive episode. So every 6%, that's a huge number. And I'm talking only about depression. Add to that anxiety, which is almost similar. The prevalence is almost similar. So we are talking about 1/3 of the world, right? So these are things which are very common. If you read about psychiatry, if you have even basic understanding about psychiatry, you would also become a better doctor, irrespective of what kind of a doctor you are. Even if you are a surgeon, even if you are a medicine specialist, your patient care would improve.
Yes, 100%.
And thirdly, if you want to become a psychiatrist, so first of all, how would you know whether you want to become a psychiatrist or not? Right? The exposure to psychiatry is quite minimal, especially in Indian medical colleges.
Medical school, yes.
Right? When you read psychiatry, you may find it boring, or you may really love it. There are many people who...
I'm on the latter side.
Yeah, so when you start... I remember thinking this in my medical school. I think I read psychiatry in my third professional exam, and in the final year I was reading psychiatry again, and I was like, psychiatrists are great and surgeons are great. Surgeons are great because when nothing is going on, when nothing is working, a surgeon might come and save your life. And for psychiatrists, I thought that okay, there are no investigations, nothing, no tests, and still they make diagnosis and they do this amazing stuff. So I got fascinated with psychiatry in my third year itself. And the same story is for many students. Again, I get many messages from students that I read psychiatry and I really loved it, and this is the only thing that I can do. So if you read psychiatry, probably you would discover that you do have a penchant, you do have a thing for psychiatry. And one of the problems is that you may not have as much clinical exposure to psychiatry in the medical school, and reading and enjoying psychiatry might be a bit different from practicing and enjoying psychiatry. So for psychiatry, we say either you love it or you don't, right? And if you don't go for it. I mean, it's not for everybody. You have to love psychiatry to become a psychiatrist. And if you love it, you will be very happy with your career. For example, I cannot think of doing anything but be a psychiatrist. If you put me back in class 12th, I would again appear for PMT, I would again appear for PG entrance, and I would again become a psychiatrist. Yeah. At the same time, probably if you had asked me this question during my internship, at that time I was okay with both medicine as well as psychiatry. But once I came back from US, I was like, okay, I have to go into psychiatry because it's a cool branch, a good work-life balance, all those things. But now I love psychiatry for psychiatry, not only those peripheral things. So I think I went on a tangent again. but you were asking about medical
anything
students.
You say is more information.
Yeah. So
anything
I
you say
believe
is amazing.
I believe you should read psychiatry, and becoming a psychiatrist is on certain levels it's very enlightening, right? The kind of things that you start with are I'll share this thing with you. I don't know if it makes sense to people or not. But when I was doing my MD in psychiatry, when I was in second year or third year, there was a time when I was very dissatisfied with the branch. The reason was during our MBBS, we are so high on the receptors and pathophysiology and mechanism, alpha, beta, rho kinase and all those fancy terms. And then suddenly you get into psychiatry, and all those things are there in psychiatry too. Yeah. But then we are talking about emotions, we are talking about relations, we are talking about social situations. And there was a time when I was like, this is not medicine. I mean, what the hell with relations and emotions and all this nonsense? This is not what a doctor does. Cannot measure it. Yeah. And there was a time when I was unhappy with psychiatry. But after completing my MD and after spending so many years in the private practice, I realized these things matter more. Right? Say you have a patient with diabetes, and the person comes and tells you that my sugar is so much, and I feel tired, so I'm not able to spend time with my children, or I'm not able to do certain activities that I was able to do. Now for that person, how you talk with him with the problems is more important than telling him that there are two types of diabetes, and this is the receptor and this is the insulin resistance. So all those social things, all those paramedical things, if I can use that word, they become so much more important than the core medicine when you get into practice. When we talk about successful doctors, you must have heard that he's the biggest surgeon or he's the biggest psychiatrist. Do they know different things, or do they do different surgeries, or do they prescribe different drugs?
Same.
No. The medications prescribed are almost exactly the same by almost every doctor. But the soft skills, how you talk to the person, whether the person feels that you really care for the person, how you address other things along with the illness, all those things matter so much more, right? It's a common saying that don't manage the symptoms, manage the patient. Don't treat the symptoms, treat the person, right? You might feel that having an absolutely rigid sugar control is the important thing, but probably the patient does not want that. The patient does not. Patient wants something different. So all those things, you become more aware if you are doing psychiatry. You become aware of these things, even other branches too. But as a psychiatrist, you tend to read, so many more things, and it's a more wholesome experience, if I can use that word. But not for everybody. Again, disclaimer in big bold words, not for everybody.
So, sir, as you mentioned, we do not get much exposure if we compare it to, let's say, medicine or surgery in our Indian medical school, or any medical school, I would say, as comparatively for psychiatry and compared to other things. So, what is like a day in the life of a psychiatrist, a day in the life of Dr. Praveen Tripathi? How does that look like? And maybe with that we can gauge our expectations of the branch, and maybe we can see if we can have a more clear idea if we fit there or not.
It's not that different from life of any other doctor. It's almost exactly the same. Even so, this is something that we were discussing before the podcast started. In psychiatry, we are more into psychopharmacology, use of medicines and all, and the therapy part is often taken care of by the clinical psychologist. So, like we do in any other branch, maybe we give more time to the patient, we spend more time with the person, but at the end of the day, it's quite similar, and it's not as interesting or as fascinating as it sounds from outside. So my wife is also a psychiatrist. We were PGs together, and people make a presumption that when we would fight, we would use the defense mechanisms and we would talk about, we would talk about, fancy
Acting
stuff.
out.
Yeah, but it doesn't happen. I mean, we usually fight because, I do not do some work, or I forget to switch off the lights and something, the same mundane stuff that all couples fight
Yes.
about. So life of a psychiatrist is not so much different from any other doctor. Some people think that if you become a psychiatrist, at the end of the day, you might end up developing some psychiatric disorder yourself. So that might happen, right? All of us can develop depression. All of us can develop anxiety disorder, but it's not because of
Because
the
you're
branch.
aware about the. Because you're
No,
aware
because-
about this
No,
knowledge.
because it is so common.
That's why.
No, because it is so common.
Okay.
You can develop depression. I can develop depression. Anybody can develop depression. Probably I would be able to diagnose it much before anybody else would be able to, or I should say I would be able to realize about it much before than other person. But my susceptibility is the same as susceptibility of anybody else.
Of course.
But that thought that because of the branch you may develop some kind of psychiatric illness, that is not backed by science. It is hearsay only. People talk random stuff. Another thing is, again, this is something that I am reminded of. Many people ask this question, so I'm just answering it here. Many people say, in fact, you had also written it in one of the questions, that what are the qualities, or
Yes.
what you should keep in mind before choosing for psychiatry. See, some people send me a message that, sir, I am very good at counseling and I think I can become a good psychiatrist. And some people say that I am not good at counseling. I don't have that big an attention span. I'm not that calm a person, and although I want to become a psychiatrist, but I don't think that would go with my personality. So, I mean, if somebody is listening to this podcast, if you look at my personality, even I'm not a very calm person, right? I'm usually excited and what we call as hyperthymic. So that does not stop you from becoming a good psychiatrist.
Good psychiatrist. Yeah.
Those are the skills that you learn during the residency, and anybody can learn those skills, right? So whether you think that you are a good counselor or whether you think that you are a bad counselor does not really matter. Like in any other branch where you develop the skills. If you become a surgeon, you develop certain skills. Similarly, if you become a psychiatrist, you develop certain other skills. And I don't think your personality has got to do anything with you becoming a good psychiatrist or a bad psychiatrist, unless you are on the extremes, right?
Of course.
For most of the cases, it would not matter. So just to sum it up, life of a psychiatrist or an average day in the life of a psychiatrist, it's not so much different from life of any other doctor. One good thing is that I believe we have a better work-life balance. We can work in inpatients. If I want, I can work in the psychiatric hospitals. And of course, if you work in the psychiatric hospitals, you get rewarded financially in the same way. But if you're a person who says that, okay, I'm okay with a balanced lifestyle. I don't want to keep on running for money, or I don't want to keep on chasing a certain number. Then you can live a very good life, very balanced life if you opt for psychiatry. Even in COVID times, it's very easy for us to see all the patients online and without disrupting the level of care. And all of these things are pretty good. I see them as big positives. So so all of these are good things about psychiatry.
That's about it. Okay, so we will keep all these things in mind, and I think we have a better look into a life of a doctor as a psychiatrist, and especially when you're a psychiatrist and a good, a very, I would use the term popular topic, very concerning topic these days is mental health. Mental health, not only in medical school, not only in work, but everywhere around the world, and sometimes it is not given that much of importance. It is usually, I'm not generalizing it, but sometimes given the backseat. So what are your views on that, and how we should push that mental health is also important as important as your physical health or social health? Mental health is equally important.
Yeah, so very rightly said. People tend to ignore mental health. at personal level too. Say you had pain in your right knee for like 10 days. You are likely to go and see an orthopedician and get it checked out and get an MRI done. But say if for 2 weeks you were having issues with your sleep or your mood, it's less likely that you would go out or reach out to a psychiatrist or try to fix it.
Also, sir, there are stereotypes like who goes to these doctors, who goes to psychiatry, like all of that. So
Right.
it's always given a backseat. Not always, sometimes. So
So,
I think it
see-
should given with a
Yeah, so the thing is, you can delay it. You may delay going to a doctor, but if there is a problem, you eventually will have to take help, right? More so for illnesses like schizophrenia or bipolar disorder, the serious mental illnesses. Uh, just thinking that they would resolve on their own just doesn't happen, right? Finally, people do have to go a doctor, and people do have to take care of it. But I think we were discussing something different here. At least at an individual level, we should be very careful that we take care of our brain or mind in the same way that we take care of any other organ of ours. Because
true.
see, you may have a fracture, you may have a diabetes, you may have any XYZ disease, and you can live with it, you can manage it. But if your mental health is in shatters, it is difficult to do anything. This is a common thing that people come and say कि ये दिक्कत ना हो कुछ और हो जाए, क्योंकि at the end of the day the brain is controlling everything else. And
Yes.
one of the reasons why people are not able to take help is that whole idea of being weak or strong, right? Going even acknowledging that you are having depressive symptoms or acknowledging that you are having anxiety symptoms, it is equivalent to you not being able to take care of your life, or you not being strong enough. And that is an idea which is disturbing to most of us, right? More so for the guys, guys with all their macho thingy, and they're like कि नहीं हमें तो नहीं होता, मर्द को दर्द नहीं होता kind of thingy, psychological दर्द तो बिल्कुल भी नहीं होता, right? So that kind of acts as a barrier at the first level. You are yourself not able to even acknowledge that you are going through a problem. And then add to that, if you talk about this with any of your friends or family members, more often than not the answer is कि कुछ नहीं होता, सब ठीक है, खाओ पियो, योगा
सब ठीक हो
करो,
जाएगा.
दौड़ो भागो, सब ठीक हो जाएगा. It's all in your head, right? So that is a second level where people find it difficult to meet a doctor. And unfortunately, even physicians tend to do that. Our physicians are unfortunately they do not have that much exposure of psychiatry, and sometimes they also end up giving this counter productive advice that कुछ नहीं है, सब ठीक है, iron की गोली खा लो. So that is why I keep on talking about these things with the young doctors. Tomorrow all of you will become cardiologists, gastroenterologists, will go into different fields. And you must keep this thing in mind that if you find a person who's having depressive symptoms, and if you find a person who's having anxiety symptoms, unless you fix that, whatever you are trying to fix would not get fixed, right? If you are a diabetologist and your patient is not taking pills, if he is not taking his oral hypoglycemics, and if you do not acknowledge that his depression is stopping him from taking pills, if he is hopeless, he does not want to live, why would he take your pills? And if you keep on focusing on the pills only, you will not be able to treat that patient. So remembering that mental health would always pervade irrespective of what your specialty is. It's extremely important. So we can ignore mental health, but your mental health will not ignore you, right? Your life, your productivity, your outcome, even as a doctor or as a patient, is very much dependent upon how you feel mentally, and that is a fact. You just cannot wish it away, right?
Yes.
So if something is there, if it is the truth, if it is the hardcore fact, it's better, it's more healthy that you address it, take care of it, and if you face an issue, go out, seek help. You may not get help easily. Your seniors may not help you, your friends may not help you, but there is somebody always there who is willing to help. And I think you owe it to yourself. This is your responsibility to take care of your brain too.
Yes. Okay. That's, I think, a good message where we can end this beautiful conversation of ours. And I legit think this was one of the most enlightening conversations I have had. So thank you for that. Thank you for joining me and lots of others who will be watching this for the podcast, and I for sure gained a lot of insight on everything. And yeah, sir, thank you so much for joining me on the podcast.
Thanks for having me. Thank you.